mode.
Okay, good afternoon, everyone. This is Cheryl Welbeck. I'm the Project Director for Directors of Health Promotion and Education, and welcome to this afternoon's webinar. To get a few housekeeping items out of the way, to the right of your screen, you'll see a control panel. There you will be able to raise your hand if you have questions, or if you have questions for the presenters, please use the question box, which is at the bottom of your control panel. Additionally, there's a chat feature. You can take advantage of that to communicate with either the presenters or others on today's webinar. We'd like to ask that you hold any questions that you have until the very end of today's presentation. And I'd like to go ahead and introduce today's presenter. Today we have with us Dr. Alexis Skoufalos, who is the Associate Dean for Strategic Development at the Jefferson College of Population Health, where she's responsible for facilitating external partnerships and collaborative initiatives. Her team implements the college's professional development activities, including expert panel roundtables, conferences, and symposia. She also oversees JCPH's external communications, including the college's affiliated peer-reviewed journals and newsletters, blog, and social media. Dr. Skoufalos served as co-editor of Practicing Medicine in the 21st Century, 2006, Medical Quality Management Theory and Practice, 2009, Healthcare Quality, the Clinician's Primer, 2012, and most recently, Population Health, Creating a Culture of Wellness. She's been the primary author of articles and editorials related to medical education, quality improvement, patient education and engagement, and staff recruitment and retention, and she's the associate editor for American Journal of Medical Quality and serves on the editorial boards of Population Health Management, Population Health Insider, and American Health and Drug Benefits. Welcome to today's webinar.
Thank you so much, Cheryl. Good afternoon, everybody, and thank you so much for making time in your day for this call and for your interest in the Hearst Health Prize. I really appreciate the very kind introduction, and just wanted to let you know that at Jefferson, I'm working very closely with our dean, my colleague Emily Freilich, and the faculty on this really important project. On behalf of everyone at Jefferson, I'd really like to thank the CDC and DHPE for giving us the opportunity to talk with you today about the Hearst Health Prize, and I hope you will all consider putting in a submission. JCPH is the nation's only institution dedicated to the study and practice of population health. We're dedicated to preparing health professionals to lead transformative change that will improve health outcomes. And thanks to the support and vision of our partners at Hearst Health, we have an exciting opportunity to uncover and reward outstanding achievement in population health. I know how busy all of you are, so we're going to do our best to keep this webinar brief while making sure that you understand the process and that we have time to understand any questions you have. Here's how we've organized the time together, which will cover the items outlined in the agenda. First, I'd like to take a few minutes to give you some basic information about the competition and the purpose behind it. Next, I'll tell you a little bit about the panel of judges, which includes some of the most prominent experts in the field today. Then we'll review the program goals, the types of programs and submissions we're looking for, and the eligibility and evaluation criteria. We'll also take a closer look at the application and review the timeline for the next few months leading up to the award. We'll allow ample time for any questions you have about the criteria, the application, or anything to do with the competition. And last but not least, at the end of the slides, you'll see contact information for me and for my colleague Emily, who's managing the project. Either of us will be able to help you with any questions you have after the call. So let's move on to the heart of today's conversation. This slide is a screenshot of the website for the Hearst Health Prize. It's anchored to the College of Population Health website, and you can easily get at it through www.jefferson.edu/Hearst Health Prize. The site contains a brief description of the program's purpose, answers some key questions, and has a link to the submission form for the application. There's also a link to the official rules, information that has a dedicated email address where you send the application and where you can direct questions, and a link to my email. This next slide just captures the basics about the prize in a nutshell. One winner will receive a $100,000 cash award in recognition of their successful work in improving population health. The competition is open to organizations, individuals, institutions, or collaboratives, and the call for submissions opened October 1st and closes October 23rd. The key themes regarding what motivated Hearst and Jefferson to partner are outlined briefly here. We really want to learn about things that are working on the ground. There's frequently hidden gems that would be valuable to others. People learn best by emulating things that work well that other people have done. So the idea is for us to spotlight successful initiatives like yours and get the word out so that others can learn from and borrow from your ideas. And hopefully that'll help to accelerate the adoption of best practices. We'll review, evaluate, and use the lessons learned to inform ongoing quality improvement efforts and hopefully by extension improve health outcomes across the country. It's important for everyone to understand this is not a grant program. We're not soliciting proposals for funding for a project that you wish to implement. The Hearst Health Prize is meant to reward and recognize achievement from an initiative that's already underway. We're looking for programs with demonstrated outcomes, even if it's just results from an initial pilot. The panel of judges was announced September 12th. Let me tell you a little about them. I'm sure some of the names will be familiar to you, but maybe not. And then you'll find some more detailed bios and photos of the judges on the website. Nancy Ann DeParle is one of America's leading experts in health policy, management, and financing. She led President Obama's successful effort to enact the Affordable Care Act, and she managed its initial implementation. Mark Fendrick is an expert on value-based insurance design. His work focuses on connections between clinician payment, consumer engagement, access, quality, and cost. Tejal Gandhi is a leader in leveraging technology to improve the quality and safety of care delivery and was recently recognized as one of the 100 most influential people in healthcare. Stephen Lieber is an expert in technology standards, electronic health records, and data applications. Mark McClellan is a health economist and health policy expert at Brookings. He's also a former administrator of CMS and a former commissioner of the FDA. David Nash is the dean of JCPH, and he's an internist who's internationally recognized for his work in public reporting of health outcomes and improving the quality of care. Belinda Rutledge is devoted to quality improvement, innovation, and accountability in healthcare delivery, and she recently worked at the Centers for Medicare and Medicaid Innovation. Jim Shibanoff is the former editor-in-chief of Milliman Care Guidelines, the evidence base used by CMS and health providers to ensure quality of care. And last but not least, Mark Smith is a former executive for the California Healthcare Foundation and the Henry Kaiser Family Foundation, and he's widely acclaimed for his expertise in identifying and evaluating high-quality health programs and interventions. And this next slide is just a screenshot where you can find more detailed information and photos for all of the judges. Let's move on to some of the details around who may apply. The parameters regarding eligibility are pretty clearly defined in Section 3 of the official rules, which you can also find on the website. The competition was designed to encourage broad participation across a range of organizations, institutions, and collaboratives. The competition is open to anyone whose principal base of operations is in the United States. Employees or family members of Hearst, Jefferson, and their parents, affiliates, and subsidiaries are not eligible, and the same applies to the judges, their employees, family members, and affiliates. If during the course of the competition we discover that any such relationship exists with a judge, he or she will recuse himself from the judging panel. The applications submitted will be reviewed and judged based on the following 5 criteria. The criteria are spread over 5 areas which carry a specific weight in the overall scoring of an application. And the total number of points would be 100 over the whole each 5 areas. The areas were chosen with an eye toward encompassing the different determinants of health: the use of evidence-based best practices, the ability to replicate and sustain the model or project, the ability to improve communication and engagement amongst healthcare stakeholders across the spectrum, and innovation. The first criterion, population health impact or outcome, accounts for 30% of the score. It's critical that the submission use appropriate data, either quantitative or qualitative or a combination of both, to demonstrate a measurable change, impact, or improvement as a result of the intervention. Use of evidence-based interventions and best practices is also, that's worth 35 points, and that's particularly through use of clinical decision support or care guidance. In other words, the project, initiative, tool, or intervention is based on or encourages the adoption of best practices. Scalability and sustainability. We're looking for indicators or measures that document the ability of the intervention to be scaled up or adapted for use by a larger group or population or similar populations in other geographic settings or communities, and to demonstrate financial viability, independent of grant funding. So I know a lot of you are probably have received some initial grant funds, and we're looking for ways to extend things past the initial funding. The fourth criterion is promotion of engagement, collaboration, and communication. It's really important. You can't really do a population health intervention without making sure that you've got good communication among all of the stakeholders that are involved. And last but not least, we're looking at innovation, somehow incorporating the use of a novel approach, technology, tool, intervention, or collaboration. The submission process is pretty simple. The Hearst Prize project team, we're going to be reviewing all incoming applications upon receipt for completion. We'll make sure that everything is done and keep a record of each submission and track it. A committee of our faculty will conduct a preliminary review and scoring of those complete submissions. And then the top 25 scoring submissions will be sent to the judges for consideration as finalists. Up to 3 finalists will be selected to make a presentation during a special poster session at the March 2016 Population Health Colloquium in Philadelphia. And anyone who's chosen as a finalist will receive travel, hotel, and pre-conference registration. The submission form is pretty simple, and this is a screenshot of the form, and again, that's downloadable from the site. Using the link on the website, you can download a simple Word document that expands to accommodate your responses to 10 questions, in addition to gathering your contact and demographic information. That's pretty much what the first page is just getting all of the contact information and understanding what the type of application it is. But let's take a few minutes to review that second page. Items 1 and 10, first and the last, have word count limits. Item 1 is where you'll give a concise description of the project goals, intervention, the target population, and outcome. It's kind of like an abstract for the application. That's limited to 200 words. Item 10 is a personal statement that allows you to share anything that you feel wasn't adequately covered in your responses to the other questions. That is limited to 750 words. It also asks how you would use the prize if your application is chosen. The personal statement info doesn't really carry a weight, but it's used as a tiebreaker if necessary. It'll provide the judges with insights that may help them during the deliberation phase if there are a couple of submissions that have similar scores. All of the applications are emailed to Hearst Health Prize at jefferson.edu. You may choose to include additional documentation to support your submission, which could be in the form of letters of support or testimonials, data in the form of charts, graphs, tables, or slides, video or photos. Please note that any of this supporting documentation is optional and it is not a requirement. During the 2 weeks after the submissions are closed, Our faculty will conduct their preliminary review and will prepare packets for the judges. The judges will then have 4 weeks to review, score, and return their results to the JCPH team that will compile all the feedback and prepare a summary. The judges are going to deliberate and select their finalists in December 2015, and in January, we'll notify the finalists. March 7th is the date of the special poster session for finalists at the opening day of the Population Health Colloquium, and Tuesday, March 8th, at the morning's opening session, is when the winner will be announced. At this point, I just want to say the key contacts here are Emily Freilich, who's the project director, who's been managing all of the details, the logistics, the applications and questions, and me. I've been helping Emily out, and we've been working with our colleagues at Hearst when questions arise that we're not necessarily sure how to answer. But I would encourage you to send any general questions to the same email where the submissions go, Hearst Health Prize at jefferson.edu. We monitor that daily, and we get back to you as soon as possible. So at this point, I'd like to open the floor to any questions. I'm sure there's probably a few of them. We've run into several that folks have been asking, so fire away.
Okay, so Dr. Skoufalos, is this the first time the Hearst Prize is being offered?
Yes. Right now it's a 3-year cycle, but this is the first year of 3 years that we have guaranteed funding. And I'd like to stress for our part, this is a learning experience for us as well. This is the first time we've put this together. So we are open to any feedback from applicants or from people who are, if you have questions, if you're finding things difficult, we'd like to know about that so we can improve for the next cycle.
Okay, thank you. You did mention that applicants may submit additional documentation, and you gave examples such as data, videos, or letters of support. How do those figure into the scoring when the applications are reviewed by the judges?
You don't get extra points for them one way or the other, but I think if you're making a claim as to a result or an impact, it's nice to see the information.
Just a way to illustrate. Yep. And it's important to try to make it easy for the judges as well. So for example, in the application, if you want to state, oh, we were able to show improvements in this area, then you may want to write in parentheses, please refer to video labeled, whatever that is, so that it's just easy to follow.
Okay. Great. Thank you for clarifying that.
We've actually had people ask us, how long should the video be? We want to make a video. We don't want to make anybody use up any resources or time or things like that. If you happen to have a short video that's part of your project that we can link to on
already
YouTube,
accessible, yeah.
Mm-hmm.
That's all.
Okay.
We tried to make it easy. We're hoping it's easy.
Right. Okay, just a reminder to folks who are listening on today's call, if you have a question, you can either raise your hand and I can unmute your line, or if you, the easiest way to submit a question, of course, is just to use the question function at the bottom and go ahead and type it in there. We can ask today's presenters who will address your question. Okay, just a reminder, the deadline for application is on October 23rd, correct?
Yep, 11:59 on the 23rd. Actually, that's a good question too. It reminded me of something. Should someone submit something and they've neglected to do something, if they say they've missed a question or something like that, if we get it up to 48 hours before the deadline, we're happy to go back and let you know you missed something. You won't have any additional time to submit it, but we do make an effort to go over everything to make sure that the applications we do forward on are complete.
Okay. Okay, there's another question here. Someone is asking, whoops. Okay, one moment here. Okay, it says, can we submit a YouTube link, or do we actually need to submit a hard copy of the video itself?
No, YouTube link is
The link
fine.
is fine.
It's preferable, actually,
Yeah.
because the judges are all over the country, so it's easier for us to send them to a link.
Okay.
Oh, and Emily, too, if there's anything that's larger, you'll give them instructions.
Yeah, and if for some reason somebody has like some very large attachments or exhibits, I'll work with them around submitting a Dropbox link and that kind of thing. So no problem.
Okay.
You know, one question that we've received a few times is, you know, if we have received a previous award or prize for this project, does that exclude us from applying? And the answer is that as long as that prize or award isn't like proprietary to the other organization who awarded it, that it's fine, it's still okay to apply for the Hearst Health Prize.
Okay. Are there any limitations on how the prize money may be spent?
No.
No.
Mm-mm.
Okay. This is a great opportunity, folks on the call, to share some of the progress.
A lot of money.
Exactly. Folks on this call have kind of a limited time frame to implement their projects. In most cases, folks have somewhere between 12 and 15 months or so for this first cohort on this particular grant initiative. And right about now, folks are beginning to write success stories. So this is a great opportunity to kind of use your success story to draw attention to your community projects in a new way. So I would encourage everyone on this call to submit something.
No, I think it's a great opportunity. I really appreciate your letting us know so we could let people know about it. We're really interested in finding out what people are doing, and that's the primary driver for doing this.
And we realize there's only a few weeks left, so if for some reason, you know, a program isn't quite ready right now, you know, the next call for submissions will probably open in about May of 2016. So that's not too far away.
Okay, that's good to know too, though.
Yeah.
Okay.
I have a question about, this is Tametta. I have a question about that second submission that you just mentioned in terms of in May. Will it be similar to this one? Will there only be a month or so from the open for those applications in comparison to when it's due?
No. That's kind of the whole idea. The time frame would end in October or the end of September, because this was the first year and we were setting up the rules and the criteria and all of that. We got started a little later than we would have liked to.
We did have time working against us because for a variety of reasons, we couldn't get the word out till August. And so that, you know, that is always a difficult month to promote something.
Okay, and here's one additional question. How will Jefferson use award winners' materials, and will you ever use non-winning submissions?
That's an interesting question. Actually, it becomes the property of Hearst, I believe, the actual applications themselves. One of the things we were looking to do, and it has not been confirmed yet, it all depends on what we get. We may do a publication that sort of summarizes and you know, invite people to write an article about the program and what they've done with it, but we don't intend to do anything at this point with them. It all depends on what we get.
Okay.
It's a hard question to answer just because things are so broad.
Okay, last call for any remaining questions from folks on today's call. Okay, and seeing no other questions, we will go ahead and conclude today's webinar. Thank you so much, Emily and Alexis, for your time this afternoon. I'm sorry. Here's one more question.
I see one.
Okay, the question is, when it comes to the outcomes and results section, do you prefer the research findings report directly submitted, or would it be beneficial to break the findings report into a narrative?
I would think if you have numbers and a narrative, that would be ideal. Whichever, knowing that you only have a couple of weeks at this point, whichever is easiest. But I would say it would be nice to have both.
Okay. That's a good question.
Yeah, so it could be that on the application you want to include some highlights and some explanation, and then if you have a document with more specifics, that can be the exhibit.
Exactly.
Like a graph or something.
Okay. Are there any other questions before we conclude today's webinar? Just a quick reminder, you can either raise your hand or you can put your question in the chat box. So I'll give folks a few more seconds if there are any other questions.
And it's no problem if you think of something after it closes, just email us. Not a problem.
Yep, and you have on your screen now you see email addresses and phone numbers, and an email address for general questions. Okay, Emily and Alexis, thank you so much for your time this afternoon. We appreciate the overview of the entire application process, which I think was very helpful. So we hope to see some submissions from this particular grant initiative because folks are doing some very interesting work on the ground.
Yeah, we'd love to see them. Thank you so much for your time.
Okay, thanks everyone.
Thank you.
Bye.
Bye-bye.
Thank you.